Hello guys, welcome back to Mugure's World. Today we have a very interesting topic. I'm excited about this because in so many forums no one talks about it. So I am very excited about today's topic and what we are going to learn about this. Here we always talk to first-time moms. We want them to get prepared for this challenging duty that they already have on their hands. We are going to talk about the fourth trimester. At this point, Mama, you have already taken care, you have read wide, you have researched widely, you have done many things to prepare yourself for the first trimester. As soon as you realize you're pregnant, you started the hard work of researching and making sure that you know all about the first trimester, the second trimester, the third trimester, and delivery. At this point, you have no idea or you have not prepared for the fourth trimester or the postpartum phase. This is what we are going to discuss today in our channel, and welcome. Sit back and be prepared to learn something today. Fourth trimester or postpartum timeline. You ask yourself, when does it start? The fourth trimester starts immediately you give birth. That is when the fourth trimester starts and lasts up to 3 months post-baby. At this point, you as a new mom, you have the most challenging, most demanding, most draining times that you will ever experience while raising this little one. Why? Because at this point, your body is still sore just from carrying a pregnancy for 9 months. Your body is all over the place because of the hormones. Hormones are trying to realign so that they can produce milk. Your body is trying to get back to its normal. So there's a lot going on in your body, and there's also a lot going on with taking care of your baby. So this is where most women dive into depression. So for you not to get there, you need to be prepared. And how do you get prepared for the fourth trimester? Here are generally some of the things that you will experience, or the things that you will need to know about the fourth trimester just before you get into it. Well, after birth, your midsection area, your tummy area. At this point, you have just given birth. This is day 1, day 2, day 3 of childbirth. After childbirth, you will still look very much pregnant. You will look as big as you were when you are pregnant. At this point, you'll be experiencing abdominal pain, pelvic pain, back pain, constipation, and especially if you've gone through C-section, the constipation is on another level. So at this point, what will you do for your midsection or your tummy? You will need to take the medication that you were given, especially if you went through the C-section. Take the medications that you've been given. Buy a tummy binder. A tummy binder will help hold the abs together, will help reduce the movement of the tummy and hold your tummy together so that when healing starts, your tummy compacts together to where it was. Don't expect it to go back to where it was immediately, but give yourself time, give yourself grace, love yourself. It will just take some time and you will heal slowly. Down there, you will be experiencing a lot of bleeding, perennial pain, perennial stitches. This is where you need a sleep. Is it called sleep bath? You sit on a sleep bath with warm, salty water for it to heal. If you got stitches, through, if you went through normal delivery, maybe you got a tear or episiotomy, you got stitches, you need to take care of the stitches, you need to take care of that wound. So you need to take care of yourself slowly. If you got hemorrhoids, you will need to take some stool softeners, and you need to take care of yourself and give your body time to heal. Don't rush into it. Between this period of the fourth trimester, don't rush into having sex, don't rush into carrying so many heavy things. The heaviest thing that you carry at this point should be your baby. So take care of your body, be kind to yourself, and just give your body time to heal. On your breasts, you will experience engorgement. You will experience leaking breasts. You will experience breast soreness. You will experience mastitis. Not all the time, not all women experience all these things at the same time, but these are the things that you need to be prepared for. What will you do if you get soreness, of your breasts? At this point, you will need soap cream with you. You will need breast pump so that you can express excess milk to avoid engorgement. You will need nursing bras, nursing pads. You will need comfortable nursing bras for you to be able to hold those breasts in their place, because it will be painful. Just take care of your breast nicely. Express when you can. Store that milk. The baby will need it in future. Love your breast. Love yourself. If you're experiencing mastitis, take medication. If your breasts are clogged, massage them with warm towel. Massage well even as you express. That will give you some relief. Elsewhere, you will experience hair loss when you start breastfeeding. You will have stretch marks when you start losing that weight. You will see yourself with a lot of weight on your midsection and those other areas. At this point, you just need to love yourself, love your body. These things will go away. You may experience postpartum depression or mild depression at this point if you don't get enough help. So, how long does all this take place or take to disappear? It will depend with each and every individual. Some it takes longer time, others it will take shorter period. For example, bleeding will continue for maybe up to 10 weeks. If your bleeding is more than normal, that is between the 1st and 10th day, you bleed a lot, more than you use one pad in an hour, or more than one pad in an hour, then you're bleeding a lot. You need to see a doctor. But if you're bleeding after 10 days, it reduces, then that's okay. So you can just give it time. It will go on its own after maybe the 10th week. Perennial recovery. This will depend on circumstances of your delivery. Maybe it was it was normal birth, maybe it was C-section, maybe it was episiotomy. This process can take 3 to 6 weeks, depending on how much trauma there was and how well your body takes to naturally recover. Please love your body, take care of yourself, give your body more grace at this time. Back pain and breast discomfort will last up to 6 or more weeks, but not more than 10 weeks. The permanent changes that you will see are now the stretch marks, hair loss, your body shape will change. Maybe it will never go back to normal, but at least there will be some changes. You may go back to where you were, but with a few changes. Maybe you will experience some hips that were too slim, now they are a little bit bigger. So that is after birth. Your body can never ever go back to where it was. So what are the essentials that you will need to prepare for this season? You will need pads, sanitary pads. If not sanitary pads, maybe diapers. You will need disposable underwear, nursing pillow, nursing pad, nipple cream, breast pump, nursing bras, and stool softener. All these I've talked about it in the sections that I've been talking about. So all in all, as a first time mom, you need to give yourself, you need to give your body grace. You need to love your body. You need to give your body time to heal, even as you are taking care of this little one. When you give your body time, it will heal nicely, and you will be able to take care of your little one in a very comfortable way. This is all that we had for today. From Mugure's World, we love you, and we would like to ask you to hit the subscribe button, comment, share, and welcome back. Thank you. Bye-bye. Love you.